lives on a daily basis. So we need to be functioning optimally so that we can help our patients as optimally as possible. And that's something we then want to then discuss further today. We're looking at interacting with quite a few of our speakers who we are super fortunate have taken the time out for us today to basically unpack what it is like to have bipolar disorder and what the experiences have been. So really a huge welcome to our audience and a huge welcome to our speakers for joining us this evening. It is something we hugely appreciate, both as the Wits Students Pathology Society, as well as our student body and those who have followed us. Zoha, my co-chair for the evening, I will now hand over to you. Zoha, I think you're muted.
Sorry about that. Okay, good evening, everyone. Thank you for joining us today, especially to our lovely panelists who took the time to actually be here with us. So I would like to introduce Mix Lemos-White, who is part of the With Disability Rights Unit, as well as part of Wits Pride and the Transformation and Employment Office. So thank you for taking your time for being here with us. We have Mr. James Grevinston. Thank you for being here because he is not a former Wits student as well as an employee, I believe. And he is currently in the UK as an business consultant in the field of diversity and inclusivity. And lastly, and of course most certainly not least, we have Kanisile Rebecca, and who is a Wits BA's law student. And of course her info is going to be invaluable because she is one of us fellow students and actually is part of us. This is among us. Okay. So shall we begin? Okay, so as we all know that the reason why we are here is that our panelists live with bipolar disorder, right? And now we're going to get some insight. So I would like to ask my panelists if you all can briefly tell us what type of bipolar disorder you have and a bit more about it, actually. Stephen, thank you.
Shall I go first? So I'm living with bipolar type 1, and that is characterized by episodes of mania and depression, major depressive episodes. Yeah, and it's a difficult one to live with, but I think over the years it's gotten bearable and easy to handle. So yeah, type 1 is maniac episodes, major depressive. It's like very maniac, very depressive, basically.
So I don't have those kinds of extremes, and on the medication I'm on, that whole curve is much flatter, and I think as I'm getting older as well, I manage it differently, and so I make sure that that curve remains flat, or it's not flat, but it's certainly not as spiked, maybe.
I can definitely relate to what the previous two panelists have said, but like Kanye, I also have type 1 bipolar. I was diagnosed about 11 years ago, and it's been quite a journey for me. I'm constantly feeling like I'm learning new things about it, and for me, that's not necessarily a bad thing.
I think my diagnosis also 10, 11 years ago was a relief because I'd always been diagnosed as just being depressive. And when I realized that in fact was only part of it, that where the episodes where I was feeling quite normal were in fact my manic periods. And when I started to get a different lens or different perspective, I understood it differently. And then went into a way of managing it differently.
I think for me, I hear Tish and James say they were diagnosed 10, 11 years ago. I was diagnosed only 3 years ago. Yeah, 3 years ago. And before that, I was always told that I'm too sensitive and I'm just very moody and always just sad. So it's interesting to hear that they've actually been living with it for so long, and I'm the baby of the group, literally. And it's wow, okay.
And I think another major moment happened for me, if I can build on what you're just saying, is when the psychiatrist 11 years ago said to me, what you need to understand is that there is no cure. You will never be better. At best, we will be able to manage it effectively. And that was a double-edged sword for me. In one, it was a great relief, and the other, I felt completely shattered by that, having hoped always that one day I would feel better. But it was a reality check, and I think that that was very useful.
I think, thank you very, very much for mentioning that, because that I think is perhaps one of the hardest things when it comes to mental health, is that there isn't a hard and fast solution, and there isn't something you can do, you can take, or something that makes you feel perhaps better or like yourself. Especially if there was a time, when you could perhaps, you weren't aware of it, or you didn't feel that. And so, just before we continue, something I'd like to perhaps of is, we've got a friend with us today. He's one of those plushy octopuses. You can call him Ollie. For the safe questions, just so that you are aware, we've got the smiley face on. If there might be a possible trigger warning needed, we're going to turn him to the orange guy. Just to warn you that if you'd like to mute the audio or something to that effect, you are then aware. Our next question is on the safe side, and essentially it really goes to, do you think learning your diagnosis has impacted how you interact with people, or has it changed how you interact with people, both before and now after?
I'll answer. I think that there's a very big danger of becoming subsumed by the diagnosis or by the label, and that's something I choose not to do. It's like, am I a diabetic, or do I have diabetes? And it doesn't purely define my identity. And it's not something I'm going to hide behind either. So for me, it's a diagnosis. It helps me understand what's going on in my life. And I use the diagnosis for managing this disorder as best I can. But it's not something I carry on my forehead.
I would say that my experience has been one that, following my diagnosis, I did go through a period where I wasn't really sure who I could trust with the information, who was not going to respond in a ableist or sanist way towards me. But I think after a few months, I got to a point where I realized that it really wasn't something that was worth being invested in, and that people were going to react however they were going to react whenever they would find out. So I'm really open about my diagnosis, both in my workplace and in my private life, and it's not something that I really think about much anymore in terms of, how is this person going to react? Are they going to be judgmental? Are they going to limit, my participation or access or privileges in some regard because they feel, that maybe I am lesser because I have bipolar mood disorder? And I think taking that step to be unapologetic has helped me in many ways to be okay with that diagnosis and to branch out and meet other people who also have bipolar mood disorder, to help other people find that they...
Because growing up, I was often like I said earlier, I was told I was very moody. And now my family's like, oh, so you weren't moody. You have bipolar. Wow, so are you crazy? And I was like, So I think my experiences are like very different to James and Tish.
I will go in my world. I don't go and tell people that I manage this bipolar disorder, because for me it provides another lens through which people see me. So I make a different choice. If anybody were to ask me about it, I'm open about it, but it's not something that I necessarily tell people up front. And it's not because of shame or any of that kind of thing. It's just that there's so many lenses through which a person can be seen, and I live also in a different world, which is in the corporate world, business world, and so I'm not ashamed of managing this mental ill health or disorder or disability, but I don't put it out there. I'm not ashamed to say that I've been hospitalized, but it's not something that I would necessarily raise in conversation. If somebody were to ask me, yes, the answer is yes. So I'm not hiding, but I'm also not saying, hello, I'm not waving the flag. But that's my choice.
No, definitely. I can understand because people have their own biases, and sometimes it's better for them to know upfront that hey, this is a disability I have, and if you're going to stick around, you should know about it so you don't come across as surprised or as if I'm hiding something, or as if, or you can keep it private and it's none of their business. And if they have a problem with it, then they get to see the real you first, or the more professional side of you first before they, start interacting with you.
It's always important to be authentic, but at the same time, I'm not going to tell people that I suffer from really bad high blood pressure.
Yes.
So that, and I don't mean to minimize it, but yeah.
I understand completely. So we know what you do currently, how you don't really hide your diagnosis. But what about initially when you actually first found out? Because I know it's not exactly the easiest thing to tell individuals.
So I think that I've been quite fortunate because as a business consultant, up until recently, it allowed me to come into the world and exit the world. And so I would come in when I was feeling really good and was able to work, and then withdraw and restore. Because I had that freedom to do that. Working full time in an organization, I have to pace myself differently and make sure that that curve stays within certain parameters, because I don't want it to go out of loop, as it were. But certainly, I was fortunate to have a career which allowed me to come in and exit and come back in and exit. And the people close to me, one of my associates used to say, oh yes, you've been going on walkabout, which was shorthand for you've taken time out to just restore yourself. So that's how I've been able to work. But I've also had to make sure that in my work, I don't get carried away, that I manage it, because if I let it take me away, I'll be working until all hours of the night, for instance. And I know that the higher I get, the lower I'm going to be dropped. So I'm very, very aware of that. And so even when I'm feeling good and I can go, I think, oh, hang on a minute. We need to wind it back here. Because if I keep going too high, there's going to be a drop of the same magnitude. And so it's about pacing myself and realizing I'm running too fast, because it's an ongoing marathon. So I need to pace myself. And I think that that's also another thing another element of it is burnout, which is a lot of to do with emotional exhaustion. And so if I don't pace myself, there's a very real risk of burning out, which adds another dimension to manage this disability or ill health.
I think for me, it's been a up and down struggle between getting my family to understand, getting myself to understand, and communicating clearly how I want to be treated, how I should be treated, and taking my medication, because that helps a lot. So I think I've also surrounded myself with people who respect my boundaries and respect what I'm going through. Not even going through, but what I'm living with, you know? So I taught people to respect it, to respect me, and to just constantly. I don't like people who tiptoe around me, but I would like for people to be consciously aware of what they say and how they speak. Because often people are like, oh, she's so moody. They'll be like, oh, she has bipolar when someone's just had a bad day. So I'm always calling people out and saying, look, that's not bipolar. Trust me. We know. I know what bipolar is. So, yeah, I think it's just been an experience, a journey for me. Yeah.
I definitely think that for me, um, the first time I paused and really thought about how somebody responded to me was when a partner shared with me that, she'd had some experience in, you know, dating people with bipolar. So she asked me what type I was. I said, oh, no, I'm type 1. She said, oh, the scary type. And for me, that hit me really hard because up until that point, I hadn't really thought about it. I think there are scary aspects about every type of bipolar disorder. Whether you're type 1, whether you're type 2, whether you're somewhere in between, whether you have bipolar disorder not specified, it's all at some point a very disorientating, terrifying experience. Um, but that for me was probably one of the first markers that I'd really seen of people who had seen other people in really bad spaces in manic or depressive episodes and had been scared so badly that they would say something like that to their partner. It's an ugly illness. It is. There are things that come up that are not nice for other people to see, that are not nice to experience on a daily lived basis. And I think we think about sometimes putting forward images of mental illness that are appetizing, things that are palatable, so to speak. And, we talk about people who have mental illness that people can easily relate to. Maybe you go through a period of depression and it's only a period of depression. Maybe, you're somebody who has a anxiety disorder, things that are perhaps more accessible, but not in any way easier to live with. I feel like there are parts of people's minds that are reserved for people that have mental illnesses that aren't as visible. And not necessarily just bipolar disorder, thinking about schizophrenia, thinking about, other illnesses that can also involve psychosis, involve sometimes being on medication that has quite scary side effects. I think that it is a part of some people's minds, where there's a bit of a shock reaction when you do find out. And I can understand how that is informed.
I'd like to build on what Tish said, mental disorders, for want of a better word. There's a whole lot of intersectionality. Tish was talking about people who might have anxiety disorders and also the side effects of the medication. So, and we need to be very aware of that. And so you can't look at it as, okay, now we're just going to look at this particular disorder. What is the intersectionality of a whole number of things? And in particular, how the side effects of the medication can amplify the distress it goes beyond the distress of having the disorder. So it can be put on medication, but now you're dealing with the distress of ongoing, never-ending fatigue. Or this terrible sense of I can't get out of bed, or everything becomes all sluggish. And so how does that exacerbate everything else? And so suddenly your anxiety is going through the roof, and you're trying to manage the anxiety. And then there's this whole balancing act that thing starts to happen. And I think that is a part of this whole thing that maybe doesn't get the understanding that it needs. And so when you go for medical care, I think that it would be really helpful if people were to think, okay, so this isn't something that's a standalone. And also, how does the medication or the therapy maybe make it worse or bring other issues to bear? I don't know how the rest of you feel.
Before we do continue, Kani or Tish, do you maybe want to add to what James has said? Because from what I'm picking up, the three of you are raising something that I personally think is really important. And the first is having a mental health disorder or illness, whether it is bipolar disorder or schizophrenia, doesn't now change who you are or alter your identity. And it doesn't become, this plaque or badge that you're supposed to wear where people see you and think, oh no, this is the type of person I'm working with. There is this human being behind that. And I think, as Tish mentioned, there is a bit of a misrepresentation of mental health largely in society nowadays, where you either show it as what might be appetizing about it, to use the word loosely, because it's this notion of whatever it is, people are looking for, or it's either, oh no, bipolar is automatically bad, you've got to watch out for this person. And I think it's got to be really, really hard to work with, because if you're looking at your family or your loved ones, I mean, Kanya, I know you mentioned this before, these are people who say certain things to you. They're the people you kind of go to, in the morning, in the evening, in the afternoon. They are constants. And to have people who love you basically turn around and say, oh no, you're just too sensitive, or, you just overreacted. More than just hurtful, I think people need to be very cognizant of what they're saying. You can't say something without a full appreciation for what it is you are saying. And that, for me, makes this talk all the more special, because you are three people who've had very different experiences. And it guides people as to what they need to do to be better about this, because you're still human beings, I'm still a human being, and the idea is that we should still be able to see the human factor in all of this, to be there for people, to be there for each other. And I mean, do you or Tish maybe have anything to add on to what James has already said?
I think a lot. But what James said is particularly important because it does not define who I am. I am living with bipolar, but I'm not my bipolar. So of course I'm going to have days where I'm having a major depressive episode where I can't get out of bed, I'm exhausted, I don't want to do anything. And then there's days where I am at my peak and it'll last for a very long time. And so I remember speaking to my psychiatrist and telling her that this is what I've been experiencing. And she was like, okay, so have you been taking medication? Have you been behaving? Have you been doing X, Y, Z? So it's a tricky thing. You have to, like James said, you have to keep the balance. So you're not too up, but you're not too low either. I think that's important. And I'm still learning how to keep it here, but yeah, it's not easy, but it's a day-by-day thing. I think with living with bipolar, it's a day-by-day thing. There's no instant solution to living with bipolar. It's a constant, my psychiatrist likes to say, it's a trial and error. We are trying to get you better, but along the way, we're going to make some mistakes, go through hurdles, and so I think it's a trial and error, but that my life and living with bipolar itself are a trial and error, because just because I'm living with bipolar doesn't mean everything else is flawed, you know? I think I'm living with bipolar, but it doesn't define who I am, basically.
Definitely to add is for me the value of being diagnosed, I guess, relatively early in my life has allowed me to have, I don't know how many years I have left, but X amounts that I've learned about the disorder and I've learned ways to manage it in my own life. But to reflect on what James had touched on several times, the sometimes quite a burden of being on medication and how that can be very difficult. Yeah, I mean, I think that, if you look at the medications that are used most routinely to treat bipolar disorder, I mean, you're looking at things like your typical antipsychotics, your atypical antipsychotics, mood stabilizers, including lithium, and medication that is also used to treat epilepsy. Um, those are the ones that I've seen people in my life most commonly on, and others are on antidepressants, including myself, or medication for anxiety. I had the experience of being on some of the typical generation, the first generation antipsychotics, when I was consulting at a local clinic. Um, and that was prior to being diagnosed with bipolar, but at that point, all the symptoms were there, and the doctors really wanted to find a way to manage it. And the medication was really, really difficult to, live with on a daily basis. I remember thinking that, the side effects was something that I couldn't commit to for the rest of my life. And, then I moved to seeing a psychiatrist privately, and medical aid thankfully covered accessing atypical antipsychotics. And I just remember, being on Abilify and Seroquel. Sorry, I don't know where I got lost. But I was saying that, going on to Abilify, Seroquel, and Epitech brought me to a point where I was perhaps the most stable that I had been in my memory at that point. 3 medications that, well, 2 of them I stayed on until, present. Um, and for me, the trial of getting to that point, the trial of being on medications that had made it very difficult for me to, go about daily living, had led to being on medications that really made a difference in my functioning. And for me, it was worth it. It was worth, finding out that no, I'm not really the best candidate for typical antipsychotics. But yes, my body responds really well to atypical antipsychotics. Um, Currently, I'm also on lithium, and that's worked incredibly well for me. For me, though, what has really been a contrast was a period during which I was hospitalized last year and had an experience, where things had gone wrong. I'm just going to go with gone wrong because I don't particularly want to trigger people. And through a series of things that had gone wrong, I ended up on a ventilator for 10 days, and obviously you can't really throw lithium tablets, down the throat of somebody who's on a ventilator, let alone the other things that I've mentioned. And when I was extubated, I just remember having the worst manic episode I had ever had, effectively having not been on any treatment for 10 days at that point. I'm thinking my medication is worth it. I have to stay on this medication. It makes a massive difference. And sometimes I feel like that contrast, is one of the most useful reality checks I have received.
I agree with you. I think that there's a moment where you realize and you weigh up the consequences of being on the medication and the consequences of not being on the medication. And it's that whole, okay, really, and I'll speak for me, I'm a far nicer person when I'm on my medication. I don't even like myself when I'm not on the medication. And so the trade-off are all the consequences of the side effects. So I'm not as sharp intellectually. My mental acuity isn't as sharp. A bit of a fog. Put on weight. A whole lot of things. My sleep is not great. And I can never get enough sleep. And so on and so forth. But I weigh it up, and I certainly would not want to be without the medication, and I take it religiously at the same time every night. Yeah, and I know how the medication has actually allowed me to live the life that I've led. I'm oftentimes envious of people who don't have a need to be on any medication. I kind of have this fantasy of what their lives must be like. Boundless energy and all the rest, but that isn't the life I have. However, the medication has allowed me to engage. I'm married and I have a great relationship there. I do work and have done work that's meaningful. I've been able to look after myself. So there are a whole lot of things it's allowed me to do, but notwithstanding the fact that it does come at a cost in terms of the side effects.
I think that it also quite literally comes at a cost. Medication for bipolar disorder is not cheap. I think about when I went on Bipolar, there was, I think, my highest dose of 20 milligrams, a copay of something like 2,000 rand a month that wasn't getting covered by medical aid. That was just something that made it a sacrifice every month to have to find a way to afford it. And so I got into contact with SADAG. I got into contact with Doctors Without Borders, with Section 27, and they ran a program on making Abilify accessible. They petitioned to government to say that this drug, and many others included as well, should not be a drug that is only, something that super wealthy people can easily afford. And thankfully, after petitioning to government, it was a couple of months later the first generic was released, which I think was Irizafar. And today there's, I think, over at least 6 or 7 generics. So I have seen really useful evolution in some of the medication that we're currently, kind of predominantly being prescribed.
And of course, that experience is completely on the other side of the experience of living in the UK. So I cannot say this enough, is how incredible the NHS actually is, and that whole national health system. Now, this is, of course, a country that has the ability to afford it. And I'm not saying that the NHS is perfect, but I will say this, that I get my medication, I pay a nominal amount every year. I think it's, I'm trying to change it, about 2,500 rand a year. But that covers all my medications. And in turn, that takes out a huge amount of anxiety. Because I'm, just to build on what you're saying, you've got to factor in the financial costs and how do I afford this. So I'm fortunate to be living in a world and where people are able to access medical care and medication. And to all intents and purposes, it's real. It's not at the cost to that person right there. Yes, we pay for it through national insurance and the tax and all the rest, but it's a resource that's there.
Like Tish said, bipolar medication is expensive. I was on Epitech, I was on Epilim, and I was on Ativan. And I realized at some point I can't afford this. I can't put that responsibility on my parents because there's sometimes a co-payment of like 600 and we did not budget for that 600. So it's kind of an issue of, do we want all three and pay a co-payment of 600 per medication, or do we just work with the one that the psychiatrist recommends the most? So yeah, bipolar medication is not cheap, and even in the government sector, I've spoken to a couple of people that get their medication from government clinics, and some of them have had bad reactions to the medication, and it's an issue of, is our government prioritizing mental health, or are they just winging their way through it and just giving people what they think people need without considering that we all experience bipolar differently, but there can be not a standardized version. I don't think it's fair to call it like a standardized one-size-fits-all type of medication, but there is medication that actually, like Tish and I are on Epitem together, so there is stuff that can be used or can be given out to help people with their bipolar. It's just our government is lazy.
I wanted to expand on what Kanye's just said. I feel that every psych medication available in the private sector should be available in the public sector.
Yes.
I really do not think that anybody should have to choose, between being on medication and being non-compliant with medication because their treatment is not available in the public sector. I really also feel that it puts people at an unfair advantage who have employment, who have access to resources, to be able to access the newest treatment, to be able to access perhaps some exclusive treatment, to be able to access treatment that, if we are going to compare things like typical antipsychotics and atypical antipsychotics, the fact that so many people have spoken out against being on the first and have reflected that being on the second is generally inexperienced, is characterized by having far fewer side effects, then I have to think, are we keeping medication available in our public sector purely from an affordability perspective, or are we doing it because it's easy? For me, it feels very unfair that with employment, I can access medication that somebody who doesn't have my privileges cannot ever access. For me, it's really disturbing. It's completely unfair. It's disturbing, and it feels like a system for some people versus a system for other people.
Those are excellent points, eh? Especially because medication, especially for mental health, should not be should not be like be very expensive or just for the private sector. It should be available to everybody.
Yeah.
Because we can't help people if they're not able to afford the medication and actually take them. And like Honey said, it's a trial and error basis, even not just living everyday life, it's also on the medication part, on what would suit you and what will suit the other person, because not every medication works for everybody.
Mm.
So, Honey, as you are a Wits student who is on medication and is living with bipolar disorder and everything, can you tell us what your experience is like in your academics, in working both as a Wits student as well as with your lectures, with your classmates, and what it's like?
Oh, it's been difficult. I'm not going to lie. It's been difficult because you get lecturers who really don't care, and you get lecturers who really care. So what I learned last year was that at the beginning of the year, I let my first semester lecturers know that this is what I am, this is what I'm living with, these are the possible things that might happen throughout the year. I will ask for help, and I will need help. And then you get lecturers who are very willing to help and are very eager to help, and you get lecturers who just don't care, and your mental health is just like, ugh. And I think I would appreciate it if Wits placed more importance and greater effort in taking mental health seriously, because I'm not the only one, and I've been hospitalized so many times that I've missed a lot of schoolwork, and I I'm I will be in a psychiatric facility and emailing my lecturers asking them for help and trying to get pardoned, and a lecturer would say this is still due. So it's been difficult, and it's a struggle, but I have amazing lecturers who have been so kind to me and have constantly just pulled through for me. And then there's been lecturers who have been awful and have triggered episodes and have triggered, my life, and have been triggered by their actions. So it's been being a Wits student and trying to balance academics while living with mental health issues it's difficult. I won't lie and say, oh, it's rosy. It's difficult because you have to balance your academics and you have to balance your mental health, and sometimes your academics are the cause of the exhaustion, the fatigue, and they trigger these episodes. And I remember there was a time I told Tish, I said, I think I'm going through an episode, and Tish immediately said, tell me what's going on, what happened, who do I need to speak to? So I'm fortunate enough to have people like Tish who are always in my corner. I know if I message Tish and I say, look, this lecturer is saying this, I know for a fact Tish is going to pull through for me. So it's been awful. Last year was awful. This year is even worse because I'm doing my final year, right? And so the workload is a lot. And I've been hospitalized, and I always let lecturers know that, look, I'm not at school. This is a period I'm going to be gone for, and I would like to defer exams. I would like to defer. And some lecturers would not grant defer. So I was like, just give me zero then. Because at the end of the day, I didn't ask for my mental health to fall apart. I didn't ask for my physical health to fall apart. And so some lecturers they're so insensitive. I think I was telling Tish the other day that lecturers need to go through some form of training about mental health and mental health issues, because I think they're disconnected from the reality of their students, because they often focus solely on getting academics done, and they forget that we're humans and we get tired, and some of us are living with mental illnesses, and we need I want to say special attention, in the sense that if I reach out to you, it takes a lot for me to reach out to lecturers and be like, I need help, and say I need help. It takes a lot for me to do that. But I always do it. And some of the responses are quite disappointing, It's very disappointing, and it's hurtful that sometimes you have to go as extreme as emailing the dean of your faculty, because the HOD won't listen, the course coordinator won't listen. No one is hearing you. So for me, it's been awful. I'm not going to lie. To the point where I want to leave. I want to leave because it feels like lecturers are just so disconnected from the reality. They just think they're going to teach, upload 125 slides, and you tell the lecturer, look, I'm not feeling well. I am in the midst of an episode, and I can't get out of bed, I can't do anything, and you open up thinking that this person is actually going to be concerned about you, and that person is just like, no, I don't care, you know? So I really, really, really wish Wits would put in a lot of effort in getting their staff trained to deal with people living with mental illnesses, because some of them are very disconnected. It's a huge disconnect from reality and what they want. There's a huge disconnect. So, yeah, no, it's difficult, and it's academic, and living with bipolar.
Do you think the disconnect is lack of training, lack of insight, or is it fear? Is it a feeling of inadequacy? It'd be interesting to know that, because I think that a general aversion to talking about mental health is, I think people are quite scared. I don't mean to be facetious, but I think that some people feel that it might be contagious. But there's a general energy or direction to be as far away as possible from somebody who might have a mental illness. And I sometimes think that the defense mechanism is treating you and I don't want to talk about this as a technology better and get on with it. So that's been my experience, and I think that it would also warrant some discussion around sexism when it comes to mental illness. And because I know that as a man, I'm expected to just get on with it. So take your medication and get on with it, and get back on the rugby field and do what you got to do, kind of thing. So, yeah, and I also need to say at this point, I'm in awe of what you guys managed to do, because my bipolar isn't as, not that it's a competition, but certainly bipolar 2, I think, is easier to manage. Not that it's easy, but it's not as traumatic, I think. So, and I just need to peg that. Yeah.
Definitely from my side, I would like to thank you, Kanye, for reaching out, for trying to get the support that you need. I think it's something that, I really respect in you, your self-preservation. And, always just, doing what you need to be able to get help when you need it most. I really respect that in you. I'm very sorry about the experiences you've had from lecturers that, you've reported to me. And I do want to say that if you are a lecturer watching the live feed, that if you do feel you would benefit from training about disability, that's Disability Rights Unit does offer training on disability. I would very much encourage you to get in touch if you want to take that on and become a better academic. And I feel like that it should be something that applies to any academic who does not feel that if a student is close to them that they were struggling with mental illness, they would not know what to do. I really do feel that, in my work at Wits, maybe I am not like my other colleagues, but, for me, it's very, very important that the folks who are paying my salary are people who feel that they are cared for, that they are important, that they are absolutely a priority, because they are. And also not just because you pay a salary, but also because it's a privilege to get to watch you grow. It's a privilege to get to watch you get to the point where you're going to graduate one day. And I know that there's a possibility that we are going to see become a reality.
Something I like in terms of what it is you're raising is this notion of how someone superior to you, whether it's a lecturer, superior, I use that word loosely, but I just mean someone you report to. So it could be an employer, it could be a lecturer, it could be, someone above you, basically. If that person needs training, training in terms of how to respond to this. And I think it's a kindness to basically say, you know what, it might just be a defense mechanism on some level, because I'm just thinking, you know, you're in this environment working with so many people. Yes, you get paid to do a job, but something I personally find is that there needs to be, for lack of a better word, contingency plans. If you think of COVID coming in, it was unprecedented, not known. So a lot of people could say, you know, we just didn't know what to do. You know, we didn't know how to handle it, how to respond to it. But now we're looking at being in the third wave. We are looking at being in the notion of this pandemic for at least more than a year. And because of that, there should be some level of, maybe not experience, but perhaps expertise, that sense of how do I reach out to people, how do I communicate. So similarly, the lecturers, and I'm really glad to hear that the Wits Disability Rights Unit does offer training, because, you know, that facility is there to help people, and you want to be able to approach your students, or to create a safe environment for your student to basically say, look, this is what's happening right now. I can't do certain things, but what can I do? Or how can you help me? Or please help me. There needs to be that. There needs to be the whole, you know what? I have a backup plan for you, or I have something that we can try and help. Kanye, you mentioned earlier that a lot of how you approach having bipolar disorder is a trial and error. And I think that really needs to be confronted directly, like, let's see what I can do to try and help you. You know, this is not just a job for me, you're also my student, so let me help you. And that for me brings us to an important question, potential trigger question, is how have you coped? What methods have you used to try and cope with bipolar disorder while being a student? Which ones have worked? Which ones haven't worked? I mean, James and Tish, I think your insight on this would be really helpful as well. I can imagine it would be different for each individual, but if you are comfortable to share it, please do. Kanye, you can go first.
So I have terrible coping mechanisms. Awful. If I feel unwell, I sleep. I sleep. I'll have submission due the next day, and I'll just sleep. If I cannot physically handle anything, I go to sleep. And recently I was hospitalized, and the neurologist said to me, if you are feeling overwhelmed, get into bed and sleep. I don't care who says what. If you are feeling overwhelmed, tell that person to come to me. So I've started now, as soon as I can feel that my body is overwhelmed, I sleep. Get into bed and I sleep. Or I watch something to distract me. I love watching something, but I have short attention span, so I fall asleep halfway through whatever I'm watching. So that's what I do. I watch series, I sleep, and before I used to go on like a binge. So I would be out every weekend just to avoid dealing with what I'm going through, and then regret it, and then be like, let's do it again. But I start like, since my recent hospitalization, I have now just learned to sleep when I have to, when I want to, when I need to, watch whatever I want to watch. And I had also started starving myself, and it's not a good idea. If you're watching this, I would not recommend it. 0 out of 10, don't starve yourself. And so I eat when I can. I eat, and yeah, I think take it one day at a time. It's literally taking it one day at a time. My mom always says, try your best, and your best is enough. Even if it means you get a 50%, that's okay, because you're unwell. Don't push yourself, because at some point I was sleeping at 5 a.m. I wouldn't sleep because I'm trying to get through work done. I'm sleeping at 5 a.m. because I'm cleaning my room, I'm tidying up my wardrobe, I'm doing so many things. And then it's now 7 a.m. and I'm still awake, and my mom sends me a message and I'm like, still awake. And so my mom always emphasizes my siblings and I that just try your best, and 50% is enough for me. 50% is enough, just as long as you pass. Don't overwork yourself. And I think it takes the body a while to realize that, okay, we are breathing. You have to breathe. You have to breathe. It's taken my body quite some time to adjust to just breathing. All I have to do is just breathe. I don't have to work until the sunrise. No, I can, if at 8:30 I want to sleep, good night world, I'm out.
I can relate a lot to what Kanye shared. She knows this. And, that is very much also that I've been in positions where I have engaged in self-harm. I've drunk more than I should. I have gone extended periods without eating. And I think all of these have been attempts to really control and shape and trying to get some form of agency over real triggers that have, brought about very distressing moods. And I really do think that, one of my lessons has been that these things don't work. That sustainably taking care of yourself works, going to bed at the same time every night or as close to that as you can, taking your medication on time at the same time, to quote what James said earlier, every day at the same time. There's an app I use called MediSafe that makes a noise like a box of pills rattling. It's the most annoying thing in the world, and it will make you take your medication. So if you are somebody who has been diagnosed with any chronic illness that requires taking medication every day, I do recommend it. Other things that help me cope are playing with my cats, talking to friends or trusted ones, family, and knowing when to take a break. And sometimes, as Kanye said, get to the point, nothing more can be done, it's time to rest and go to bed. And I think it's important that over a consistent period where you keep using your support network, you keep going to bed at a regular time, you keep taking your medication appropriately, you don't take substances that are going to cause episodes, then you may see results. And most of the people I know who have followed those kind of patterns have seen results. It's, for many, a boring way to live. It's a restricted way to live. But long term, the results have been worth it for me.
So, Tish, you talk about agency, and I think that that's a critical point for people to understand. And that, in fact, that desire or that need for agency, and Kanye, you were talking about not eating, and Tish made reference to that as well. It's this desperate need for agency and some kind of control, really in a situation where without the medication there isn't control, but even with the medication, we're almost giving the medication the agency, as it were. And I'm thinking back to being a student and living in an era before the medications that we have now. It was extraordinarily difficult because you're expected to perform and to deliver. And yeah, so I'm just thinking about that and how difficult it is, and also that people generally who are not exposed to mental ill health, I think that I've wondered whether it's they don't care or they don't want to deal with it. And I'm thinking about being in the world of work, whatever world of work you find yourselves in. It's a very transactional relationship, and we pay you to deliver, and so you have to deliver. And I think then to come back, it reflects your point, Tish, that you've then got to find a place in which you can be the best that you can be. So you choose a profession, or you choose to work with a company that understands or has a policy that allows this, or that has some kind of buffer or containment for that. And you learn very quickly which cultures in an organization, which organizations will work for you and which won't. But we do live in a world where you're expected to deliver, whether you're a student or working at Wits or working in other fields of work and in other places. It makes it very difficult because on the one hand, you're trying to manage your health. The second is that you're trying to manage your profession and you're trying to make sure that you have an income, and you've got to keep going. And remember, again, I want to talk about the intersectionality. It's just not only bipolar, but it's the terrible crippling anxiety that can come with that, because my anxiety is, am I going to be able to deliver? So it just fuels the underpinning anxiety, which then disables me more, or takes the rug from underneath my feet. And then that has a whole roll-on effect as well. And Tish, I want to go back to your point about we need to find not a lot of people, 1 or 3 people who will take the time to just sit with you and breathe. And I'm very fortunate. I have a husband who's able to do that, who's not looking to fix it. And I have 1 or 2 friends. Doesn't matter if one of my friends is living in Grahamstown or Nelspruit or White River, or whether it's down the road. A person who can just sit with me and breathe me to come down, or to remind me that I will get up again. And it's that is, I cannot tell you how important those people are in my life, and who simply know there's a shorthand. So one of the shorthand will be, I'm off station. So I don't want to give it a label that then takes away agency from me, because if I'm off station, I can get back to being on station, or whatever it might be. And if you've got people who walk with you, they can tell from the minute you open your mouth where you're at. So, and I think it's important to have that positive social support. And so too, I think, stop me if I'm rambling, I think it's critical that while we also find the right mix of medication, we find the right mental health professional that works with us, who we feel we can collaborate with. Because as you were saying, Kanye, early on, there's got to be some degree of collaboration in managing this distress. And that's not easy to find. And what works for me might not work for somebody else. So I work best with a psychiatrist who's very direct with me, and with a therapist who's very direct, to the point of confrontation, as it were. And that works for me, but it might not work for somebody else. I'm saying quite a lot of things here, but yeah, that's where I'm at the moment.
What I also wanted to speak to and add is that it is possible to have bipolar disorder and get a degree, to hold down a job, to live a life that is full of happiness and meaning. I don't think that it's necessarily something that is a sentence of misery and despair. I do think that it's important to keep in mind that if you are somebody who has bipolar disorder and you're a student, that it is possible to get to that point, and that there is support that's available for you. That if you choose to disclose, there are policies of Wits which will give you support in managing your disability or disabilities. Many people have more than one, as Kanye said. And that if that is the case, please feel free to get in touch. Numbers have been shared and will be put in a chat somewhere. But yeah, CCDU is available. Please do take down the number for the helpline. It's available 24/7. It's a free call. Please do get in touch with the Disability Rights Unit if you are a student or staff member who has bipolar disorder or any other disability.
You're absolutely right, Tish, in that this is not a death sentence. It's quite a journey to get to a place where it's managed, where you can manage it better. It's not a death sentence, and it does not mean that you won't achieve what your goals are. Sometimes we have to adapt our goals, but certainly it doesn't mean that it's a sentence of misery necessarily. Sometimes it might just take longer, and then we need people around us to understand it might just take a little longer.
You're absolutely right.
Great that there are those support mechanisms in place now for people, and I would urge people to really make them, put up their hand and say, I actually need the help, and there are people and the organizations that can help me, and that I deserve the help.
Yes, indeed. People with mental illnesses definitely deserve help, and it's not a death sentence or even a big stigma that people or family members, when they find out that someone they love has a mental illness, is not a death sentence. It's not gonna change you within a second. And like Kani said, what Kani's mom said is that 50% is better than nothing. And this is actually something that I like to say to my friends is that do the best you can in your current mental capacity, because your battery may be at 5%, but what you did right now, you did the best you could in that current 5%. You are doing the absolute best. So if you got 50% with that 5% energy you have, well, then I'm so proud of you. It's not just everyone who's watching right now who's kind of disappointed that, hey, maybe I should have done better, that I could have done better, I had the energy to do better. But the thing is, if you didn't have the energy at the time, and you know you could have done better, that's okay. You did the best you could in that particular time of frame.
And I want to offer a counter. Okay. And while I applaud what you're saying, I will say that in the outside world, it's not as congenial as that. And that we live in a society that's very competitive. And so it's not always easy. The thing is, we need to find the space that we're going to thrive in. And sometimes that is not the traditional routes of career development. And so we need to find out the current interest in neurodiversity, and that people with different skills can add so much. That so people that we might have labelled as somebody we don't want in the organizations are now actually advertising for people who might have a particularly neurodiverse condition or way of being in the world. And so what I'm saying is that I think we also need to realize that we bring something special. If you've had the mental illness that we've had in various ways and manifestations, I think we need to acknowledge to ourselves that it equips us with a perspective, a view of the world, an understanding of humanity. We've had to really look deep inside ourselves, work out who we are, and I think we need to work out who we want to be and what works for us. And I think, and I don't want to sound like a meme on the internet, but I think we've got to learn to be kind to ourselves. And if I would say one thing to anybody who's watching or a student, I think take a breath and just say, am I being kind to myself? Because if I'm not, I'm on the road to hell. And so being kind to myself also means, do I want to engage in this world or being in a particular part of this world or in an organization or a career path that's destroying me? Then I'm not being kind to myself. And I think it's important, and again, I would say, I think that people like my fellow panelists here who've been through and live in worlds that some of us can't even begin to imagine, it equips us with a view of the world and of ourselves and of humanity that is very, very valuable. We need to remember it. And I'm constantly amazed at how people manage to keep going, and I applaud that because it's not easy. So again, I've said a whole lot of things, but that's what I wanted to add.
No, it's definitely insightful, and I'm very sure that everyone is enjoying this and they feel this, because a lot of us can actually relate to what you're saying, that it's not easy to live in this world with disabilities and mental health problems. It is a struggle. So, can you tell us? This is a question for everyone. Is what is the best way we, as both medical professionals as well as colleagues, classmates, friends, teachers, whatever, can help you, cope better, interact better, make things much better? You know?
Can I go first? I would really like to see health professionals and mental health professionals, psychiatrists, psychologists, be less arrogant and to understand that they're not the font of all knowledge, and that in fact it's a collaborative, co-creative relationship to find a solution that fits best for the patient. That it would be really helpful if the medical professionals didn't think, this is the model, this is the way it works, this is the answer. So that for me is very important. I'm not saying that all medical professionals are arrogant, but there can be this, I'm equipped with the answer because I am the doctor, I am the whatever. And yes, we acknowledge the expertise and the training. It's about how do we co-create a relationship that's geared to healing or containment or management, where we walk together. That's what would be really helpful for me. And also for health professionals to take a breath and listen, because I understand my body. I'm living in this head and this body, and I'm the expert in me. And yeah, because I think sometimes the attitude or my experience of being with a medical health care professional has made it worse. And I think that we need to be mindful. Language defines reality. And I think that there's a lot of shaming that exists anyway. And if health professionals could just be aware that what they do doesn't amplify that sense of shame, helplessness, lack of agency. It's about we're in this together. And yes, I bring a certain level of skill and expertise and understanding. And what do you think? It's an invitation to collaborate in health management.
I agree. I would definitely say that for me, what I really value in healthcare practitioners who I have found particularly helpful in my journey is a willingness to learn. And this particularly is relevant when you are somebody who is from a population that is not predominantly represented, in clinics, not predominantly represented in psychiatry. Talking about the experiences and how psychology and psychiatry specifically intersect with race, class, gender, sexual orientation, gender identity, other disabilities, like access issues. It is really, really important to me that in any future health practitioner I seek out, it would be somebody who's willing to, as James had said, collaborate, work together towards a better quality of life, a better standard of living, and somebody who is always surprising me with their curiosity, somebody who is willing to work with me and sees me maybe not necessarily as an equal, but as somebody whose input is important.
For me, I think I agree with James and Tish that it needs to be a collaborative effort, because you come in with the expertise, I come in with my problem, we work together, and because you went to school, you studied this, does not mean you've studied me. I'm not what the textbook definition of bipolar is. I'm not the textbook definition of anxiety. So we need to work together to understand me rather than work individually. You are using the textbook version to treat a different human being. And I think for me, there's sensitivity. I think I need mental healthcare practitioners need to be more sensitive because there's a lack of, I don't know if it's compassion, but when you go into a psychiatric facility, the nurses there often treat you like you're a baby and you need to have your medication taken. And I'm like, bro, I'm grown. Of course I know what time medication is taken. I will come. Don't treat me like a child. And as friends and family, for me personally, I would like James said, you need people who breathe with you. I don't want that. If I'm going through a lot, please can I be left alone? Can I just go through the motions by myself, and when I am back on my feet, I will be back on my feet. And I don't, because for me, it feels like people often pity me if I'm having an episode. Hence why I'm just like, leave me alone. Because it often feels like people are like, oh, she's having a depressive episode. What do we do? Oh, should we? Leave me alone. Please just leave me alone. There's nothing you can do other than leave me alone. And this is what my psychiatrist and I fight about the most, that she believes that I isolate myself too much. And I believe I just need space. I want to cry and scream into my pillow, and I want to sit in a corner and just be left alone. I want to just breathe by myself. Having people around me just makes me more anxious because why are you here? And people who make a fuss about me just irritates me, it upsets me because why are you around me? And I think with partners as well, whenever I get into a relationship, I will always say, episode. This is how I would like you to deal with a major depressive episode. This is how I'd like you to deal with a panic attack. This is how I'd like you to, because often people don't know what to do. People often just say, I panic, I didn't know what to do. I didn't give you a heads up, and that's fine. But if I've told you what to do, and you insist on the opposite, then a support system is important. I have Tish. I messaged Tish at 2 a.m. Tish is asleep, but as soon as Tish wakes up, Tish is going to respond to the message I sent at 2 a.m. And Tish holds me accountable. I think you need to have people who hold you accountable. Tish holds me accountable for my behavior, for my actions, and sometimes we fight. We will fight because I don't think what Tish wants me to do is right, or I don't agree with it. And Tish will say, I don't care, you're going to do it. So I think having someone that holds me accountable, having someone that will hold you accountable is important. Tish will ask me, did you take your medication today? And I'm like, yes. Immediately Tish will go, you're lying. And I'm like, let me go take my medication. Fine, I'll do that. So a support system, someone who holds accountable. I've been to a psychiatric hospital, I think, 5 billion times. And each time I go in, nurses sort of think you're a child that needs to be babied and you need to be constantly watched. You need to constantly just have people around you. And there have been admissions where I understood why I was put in a specific room. And there are certain admissions where I was like, I don't belong in this room. But okay, that's fine. I will be in this room, like a specific room. And so for me, it's a support system that understands mental health. Because I think often people think bipolar is just throwing things around, and I have episodes like that. I have episodes where I have thrown things, I have broken things, I have done a lot. But I've had people hold me and say, it's okay, it's okay. What you've done is absolutely okay. And if this was your first response, or if this was how you felt, that's okay. Your feelings are valid. And at the same time, I want to be supported. I really, really just want to be supported by everybody, my friends, my family, my partner, my lecturers. Everyone in my space needs to support me and be understanding, because it's difficult to be with people who sort of tiptoe around you and instead of being supportive, they're worried they will offend you. And for me, it's frustrating because I'm human. I'm just living with the illness. Don't treat me like a child. Don't treat me weirdly. I'm still human, and living with bipolar doesn't mean you need to treat me differently than other people. So, yeah.
This is actually, I think, really insightful because it's this notion of, can we first see the person and then work with the person together? Because at the end of the day, people know their bodies, they know themselves the best. And I think healthcare practitioners need to be more cognizant of that in terms of what a patient wants and what they've got the capacity for as well. So, something that is very, I think, important for our audience as well, as quite a few people in our audience are healthcare professionals or practitioners in training, is as a patient seeing a healthcare professional, and your healthcare professional is, let's say, having an episode for a disorder they themselves have, which in turn affects your treatment, do you perhaps have, I don't want to say a solution, because a solution sounds like there's some sort of easy black and fast rescue answer, and I don't think it's going to be as easy as that, but a port of call for such a person? And I think this can be applied beyond the spectrum. If maybe you've got a friend who also has bipolar disorder, who perhaps you need in that moment, but they themselves are having an episode, how you sort of set that type of boundary.
Oh, heavy question. Wow.
It's a heavy question. I know we are like running out of time, but I think it is an important one for people to think on.
I think what you bring up is very important, because having a friend who has the same illness as you is good, but it's tricky, because your friend will understand why XYZ happened. Your friend will understand how you experienced XYZ, even though your experience of XYZ is different. But boundaries are important. I think this entire week I've been hearing boundaries, boundaries, boundaries. Everyone keeps telling me about boundaries. So I think it's important that we respect each other's boundaries. I need to respect the fact that you are unwell, and me coming to you with my problem just sort of burdens you. So respect my boundaries, let me go through the motions, and you go through the motions as well, because I don't like dependency, because it comes off as me being dependent rather on my friend to get me through the episode, whereas I want us to get through our episodes individually, because my approach might be different to what she wants, and her approach might be different to what I want. So honestly, boundaries, please, just, if I'm not fine, don't add on to my unwellness, if that's a word. Like, don't stress me, which is why Tish and I always refer to, because Tish and I are very close. So if Tish is going through something, Tish will tell me, look, I'm not okay. And all we do is check up on each other once a day. Even if you're not okay, just once a day, tell me, hey, I'm okay. Dealing with this right now, but I'm okay. We constantly check on each other. Once a day, twice a day, or sometimes we'll talk the entire day. But when Tish and I are going through our episodes, we often talk to each other, but it's just this is how I'm feeling today. How are you feeling? Oh no, I'm feeling like this. Okay, cool. I'm gonna go sleep now. Say, and that's it. When we both wake up, we're like, I'm awake, and that's all we do. I think we give each other space, and I think having a relationship with Tish has taught me somehow to have boundaries, because Tish often says, look, I'm not well right now. We'll talk later. And now I've started doing that as well, saying, look, I'm not feeling well right now. I don't want to talk. I don't want to be spoken to. I'm going to go sleep. And if I wake up feeling better, then I'll resume normal life. But boundaries, please, boundaries.
I appreciate that. I do. And I appreciate that we are able to share with each other where we're at. And definitely, I have to say that in a situation like that, honesty is absolutely critical. That if you are honest with people in your networks about how you're doing,
yeah,
and you let people know who are getting support from you, when you are in a space where you cannot provide that support for any specific period, then that's like 90% of the work done. Because you put out there very clearly that you are in a space where you cannot support other people. And then when there are people from outside your personal networks who approach you for support, I found that keeping it superficial and referring the person is the best policy. Because the more emotionally invested I get, the more triggered I end up. So if I'm in a position where somebody is approaching me for support and I'm in a difficult position, I'll say, cool. Let me refer you to a colleague. Let me refer you to a friend. What about your other friend? Like, have you spoken to your mom? Etc. And for me, that's been how I manage those situations. But absolutely go with that very cliched saying that you cannot pour from a broken cup. From an empty cup, yes. And if your cup is empty, if you are going to even give the guise of offering support to other people, it's detrimental not only to you, but to also people who are vulnerable. James, you're muted.
You're muted.
So thank you. So I'll just share my experience. So I have a couple of friends, and I literally mean 2 or 3 friends, that I can engage with. And one friend in particular who has a similar experience of mental health that I do, and I find that relationship is very good. We have a shorthand for engaging, and we know very quickly where the other person is. And as I say, what works for me is knowing that there's somebody there who understands from her perspective, but it overlaps with mine, and I know that she's there. That's all I need to know. And vice versa. So yes, it comes back to what Kenny's saying about respecting boundaries, and we do. At the same time, it's a tremendous source of support. And again, it's finding the right healthcare professional, it's finding the right friends. And so key to me is no drama, no rescuing, no victimhood, and no shame. And if you don't fit within those, then I encourage you to walk your own path. So I'm very fortunate. And remember that I've come, I'm 60 years old, so you learn things. And I think this is what I want to say to people who might be watching. Please understand, as Kanye was saying earlier, and Tish, that you keep learning all the time. And you learn what works for you, you learn what doesn't work for you. And I would really, really encourage you to look at and do an audit of the people in your world and be very clear about who adds value, who adds comfort, who's kind, and get rid of the rest. And that applies to your healthcare profession as well. You've got to do that audit and work out what works for you, particularly in terms of engagement with people. And I've learned that sometimes you have to fade to grey, turn off the light, close the door, I don't know, whatever you want to call it. And you need to be with people who understand that sometimes your cup is empty, and they respect that, because they know that there will come a time when the cup is full or filled again. And when you talk about somebody who has a similar experience, that person can reminds me that the cup will not always be empty. And as difficult as it can be, is to remember that the cup will fill. And similarly, that if the cup is too full and it's gushing, to say, stop a moment, because this is not healthy. So it works both ways.
You guys are absolutely right that boundaries are essential in any relationship, be it with your healthcare provider, with your friend, colleague, anyone. It is essential because we don't want to have an unfair balance where one person gives and gives and gives and the other takes, but there's nothing reciprocated, and vice versa. And it can be quite exhausting. And we are honestly have gone a bit over time. So I have two questions left. One is a crisis question that we got from one of our people who had RSVP'd, and it says, "Is it normal to feel like nothing is working? The coping mechanisms, the meds, everything, and you feel like maybe a psychiatric institution would help. It would be like rehabilitation center for your mental well-being."
Okay, so, Orange Man. Okay, so for me, I remember, I think it was the beginning of the year. I woke up one morning and I said, no, I can't do this anymore. I can't. I cannot do this anymore. Called my psychiatrist and I said, please may I be admitted? And I went. I think it's important not to feel like it's a crime or it's shameful to be admitted. It is amazing. It's amazing because when you're in the facility, you learn so many things. The facility I've been to, we have sessions every day, and those sessions are educational. You learn what type of medication you take, what it does to the body. You learn emotional triggers. So, yes, I would call it rehabilitation for your well-being. It is definitely a rehab for your well-being because sometimes you just need to get away from the noise. School work is loud. Sometimes you just need to get away from the noise, go to a space where you get help, and not just help from your psychiatrist or your psychologist, but help from occupational therapists, help from the staff themselves, the nurses. They've been amazing. Every time I go, they're always like, not you again. And I'm like, it's me again. So, yes, go. If you are feeling like nothing is working, go to the rehab. Go to the rehab for your mental well-being. Just go. It's fun. It's difficult. I won't lie. It's difficult, and it's a space where you meet different people with different illnesses, and you are exposed to them, and you then mingle together, and you learn how this person is dealing with their illness, how this person is dealing with their illness, and it's particularly important. I cannot emphasize this enough. If you feel like you are burning out, go to rehab. Go to the rehab. That's what I'm going to start calling it, rehab for your well-being. Because you go there, I always come back refreshed and able to think. And it feels like I've gone on holiday. Yes, you wake up at 6, but you can always go back to sleep. It's not a train smash. You wake up early, you go back to sleep, it's fine. But go really to this person. If you're watching, I fully advise that you go. Personally, it's been a great experience. I've had a good time, and it's scary at first because you don't know what to expect. But personally, if you feel like medication is not working and you feel like you are at your wit's end, please go. Please go to a psychiatric facility. It's going to be worth it, and you're going to come back feeling like, whoa, a brand new person. So yeah, please go. That's my advice. Please go.
I would say definitely in agreement with Kanye. Sometimes the person that needs to save your life is you. And if you feel like you're in a position where nothing is working, then it's time to do something different. If you know somebody who might have been on a psych ward, or maybe you yourself, might have previous experience, then I would 100% recommend, that you speak to your psychiatrist if you don't have a psychiatrist, that you speak to CCDU, call the helpline if you are a Wits student. If you aren't, then if you, once you can go to a public hospital to their casualty and tell them you're in crisis. If you have access to private health care, I mean, it is completely normal to self-refer yourself to an Akeso branch or a Life branch. I would be absolutely hypocritical if I were to be somebody who would say, nah, don't do it. I mean, I've been in psych wards many, 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 many times. I think we're talking over 30 times so far. I've stopped keeping count. And I've met amazing people in my journeys to psych wards. Some of the favorite people in my life are people that I've met in psych wards. And I've been very privileged that is, my experience. And definitely I can say that I haven't had a single hospitalization that I didn't take at least one game from. It's important. And I would say to the person who sent the message, listen to the warning signs. Things are not going well. If you carry on, things are just going to get worse. So please do the good thing and get help. And also thank you for submitting the question. It takes bravery to do so.
One more thing. There's a lot to gain from being in a psychiatric hospital, like Tish said. I have made amazing friends. I have learned a lot of things. And recently I spoke to my psychiatrist. I went through the notes that we were going through because I wasn't sure what I was feeling. And I went through the notes we had done in previous sessions when I was admitted. And I sat down and I said, I am ticking all the boxes of stress and burnout. And I wanted to be admitted and just so I could breathe, because I honestly feel like I'm not breathing right now. And it's not easy to say I'm gonna ask for help. It's not easy to reach out and say, this is my problem. How do we fix it? It's been difficult because my psychiatrist is like, you need to push. You literally have 4 months left with this degree. You need to push. My family is like, you have 4 months of this degree. You have to push. And physically, I'm exhausted. So I think you know your body. That's the one thing I've learned. You know your body. I know my body. You know when your body is feeling unwell. You know, when your body is just about to crash. So I think to the person who asked that question, shout out to you for asking. And I hope our advice gives you some sort of clarity and helps you get the help you need, because we don't want people to suffer in silence. I think that's one of the biggest things Tish has taught me, that you shouldn't suffer in silence. I'm here, and even if it means getting you into a kesel, I will get you into a kesel, and we'll deal with things from there. So go to a psych facility. They're not as scary as they make it seem. No, we're not being changed to beds. No, we're not being locked up in our. In fact, we're living lavish. So yeah, go to a psychiatric hospital, please. I am asking, please.
So if I understand the question correctly, this is somebody who's asking what happens when you feel that it's not working and it's not going to get better. Do I understand the question correctly? Okay, so I will tell you that there will be ongoing times in your life where you feel it's not working and it's never going to work. I will tell you that. And that's the harsh reality of it. I will tell you that there will be moments when you need to put up your hand or pick up your telephone and say, I need to be admitted. I will tell you that being admitted is scary as hell. I'm talking about my own experience. I will tell you that being in a mental hospital is not easy. It wasn't easy for me. In that, I had to face my demons face on, head on, and realize I'm sick enough to be in a hospital. And so what it did, it was like a call to action for me, and it spurred me on to action. And I had to make a decision. And my decision was, I am going to do everything in my power to get to a point where I can manage this illness better. And I found the experience different from other people. I found it very demanding. I had to be brutally honest with myself. And I had to make sure that I could get as better quickly as I could, because my time there would be limited because of lack of funds. So I want to say to the person who asked the question, it's a very good question to ask, and it's a recurring question, one that you are going to deal with on an ongoing basis. And I want you to know from me that this is an episode you're going through, and it will get better. And I encourage you to find the help that works for you, the healthcare professional that works for you. And if you need to go to a safe place called a mental hospital, you need to find the one that will work for you, and you need to do it. If you're going to harm yourself, that is one hell of a decision to take. And I want you to know that things do get better. And so, again, I can only offer you, it's not advice, because I don't really have any advice for you. I can only tell you what I've been through. And that is that I need to remember that it will get better, or it will get less bad. And you will, and I don't mean to make light of it, it's one hell of a profound question. But I would urge to find the help that works for you.
You're right. Asking for help is very difficult, and I'm honestly grateful to our panelists for providing this amazing insight. And I'm also proud of the individual who actually asked this question, because asking is difficult. And the fact that they felt safe enough to actually ask this question to us and to this panel, it means actually quite a lot. Because who knows that this question might be, who knows, this question might be something that someone was actually contemplating and you actually answered it. So now we actually have gone way over time, but I have one bonus question. This goes to all of my panelists and Tanushree. What is something that made you smile, happy, or laugh today?
Can I go first?
No, can I go first? Please. So this isn't a mutual admiration society necessarily. But I would just like to acknowledge the help that Tish gave me 10 years ago, which helped me realize that things would not necessarily be easy, but that I had it within me. Thank you, Tish. That I had it within me to keep moving forward. And so, Tish, you really helped me. I'd just like to acknowledge that. And there have been times in the intervening 10 years where you've been very much in my mind because you encouraged me. And that word is a very important word, to encourage. You put me in touch with that which gave me courage to continue. And so I'd like to just acknowledge that and thank you for that.
Thank you, James. Definitely, I can say that the highlight of my day has been taking part in the panel today. It's been amazing to see all of you, especially to see James again, because he lives on the other end of the fish pond, as I think is the expression, and I haven't seen him in quite a long while in person. It's been an absolutely amazing experience to participate today and to be reminded about what I appreciate in Kanye and her resilience that really, is something that I admire. And definitely, that I'm grateful that we're having a conversation that is frank and open and honest about bipolar disorder. And I hope that the people that we can't see tonight who have been watching have found it to be useful, to be something that they can take forward in their lives. Thank you. Thank you to everybody.
Oh, I get to go last. That's exciting. Best for last. Yeah. I think what made me happy today, there's a tie between seeing my gynecologist and doing this. I think being on this panel has been exciting. I was nervous in the morning. The whole week I've been telling all my followers on Twitter to come see my face and hear me speak. And I hope they're watching because I'm going to ask questions later on Twitter. But I think doing this and having a space to be able to talk about my experience with bipolar and everything that I've just, the ability to express myself fully without shame or fear, because often when you express yourself, even in group therapy in a psychiatric facility, it's often, let's just get through it, and it's often not even giving you an opportunity to express yourself, but it's more of, let's just get this group work done so that we can all leave. So this platform has given me an opportunity to say what I've always wanted to say. And it's been exciting. I think as nervous as I was earlier, it's been amazing. It's been great. And I am really, really glad and I'm honored that you guys asked me, out of all people, me, to do this. So thank you.
Zoha, I know you asked me that question as well, and I second a large bit of what Tish and Kanye have said. This panel discussion really has been an incredible highlight of my day. I care about people quite significantly, and I think hearing your experiences firsthand, your courage in sharing it with us on such a public platform is something I've been incredibly appreciative of, and just, seeing how far you come and your strength to carry on. I think that is something that is to be commended, and really my heart goes out to all of you. So thank you so much for that. So I know that wasn't really like the of your question. Kanye, we were also nervous. The network today has been horrendous, and I was just here thinking, oh my goodness, what is going to happen if we have a lag or we're not going to be able to do that? So that was nerves, but to calm my nerves here and there, I'd like put the TV on to see if anything funny or whatever was shown. That's my way of just de-stressing every now and then, is if I'm having something to eat very quickly or a snack, I see what's showing. And that Ice Age on. And horrible moments. I don't know what those two creatures are called, but the two things always after the acorn, that little squirrel thing. Watching it dance for the acorn was made me laugh. Just absolutely made me laugh. And then I had my mom going in the background saying, if only life was that simple, and I'm here thinking this poor squirrel never gets his acorn. So I just wanted to say thank you to all our panelists. Like Zoha has mentioned, we have gone quite a bit over time, we know. However, our audience has been incredibly appreciative of this experience, because it isn't something we have often, and being able to get into the nitty-gritty of it is very difficult. And Kani, I know you mentioned going to your gynecologist earlier. Something we just like to touch on, what we want to try and help you with, is your initiative for the Mirena. We have, to all our people listening, we have put the details in the channel description, in the event description below, and we will be putting it on our Instagram page so that you are all aware. Kani has started a crowdfunding initiative for the Mirena. It is something she needs because she has got cysts, and as a result has incredibly painful periods. So please help us out, help Kani out. The details are, as we said, in the event description. We will share it on our social media as well, because it is super important to just help each other where we can, really. I just want to say thank you to everyone for attending, for your RSVPs, your incredibly important questions. Thank you so much to Zoha for planning this event, being so very passionate about it, coordinating with our speakers, making sure everyone is available, putting the event together, co-chairing with me, and a huge thank you to our speakers for really just making it happen, for speaking for a whole of 2 hours right now, just about experiences that are really very difficult. So thank you to everyone, and that is a good night from the Wits Students Pathology Society.